Hi, my name is Chris, and I'm with the British Columbia Lung Association, and I'm very honored to be sitting here with Dr. Fay Johnston, who's joined us all the way from Australia from the University of Tasmania. So welcome.
Thank you very much. It's a great pleasure to be here.
Awesome. So let's get right into it. What was the intervention that you have been working on or you've been evaluating?
The intervention we evaluated was one from Tasmania, where I'm from, where most people heat their homes by burning wood. And there's a particular town that had a particularly bad problem with poor air quality from this. And back in 2001, there was a systematic policy change where there was a buyback scheme. And over the course of 2 or 3 years, the number of wood heaters, or the proportion of homes with wood heaters, fell from about 2/3 of all the homes in Launceston to 1/3.
Wow.
So there was a dramatic reduction in the number of heaters, and along with that was quite a dramatic improvement in the air quality.
That's fantastic. So, I mean, what was the impetus for all this? Is it wood burning is, as we know, not so great? Was that part of it? And what organizations were involved with making this all happen? It became a really obvious problem as the pollution got worse during the 80s and into the 1990s, as it became a very popular heating source after the oil shocks of the 70s, actually. Oil dropped out of popularity and was largely replaced by wood. But it became quite apparent even to the community themselves that it was causing health impacts. And then there was a concerted effort which involved local councils, state government and the Australian national government all working together to do this intervention. So money was made available and people were paid for their wood heaters, and most people chose to change to electric heating, which largely came from hydroelectricity in Tasmania. So there was a huge benefit in terms of air quality. That's fantastic.
Yeah.
And so you sort of touched on it earlier, but what was the impact of once the intervention was implemented? What were the positives that really came out of it?
Yeah, so the work that I did, that I presented at the meeting today, was evaluating, we wanted to answer the question, did this policy change, did this reduction in the number of heaters with improved air quality, did it improve health, and in particular, did it reduce the death rates in that community? So we did a study where we compared the period before the intervention with the period of improved air quality. We did an identical analysis in the 2 major towns of Tasmania, one that had the intervention and the other, called Hobart, that was a comparison that didn't have such bad air quality and never got any interventions.
Wow.
And we compared death rates before and after in both places. Statistically, it was complicated. We had to think about the ageing structure of the population, flu epidemics, the background trends. Deaths from heart disease have been falling anyway over the last 20 years. You know, smoking rates have been going down. There's all sorts of factors going on that we had to tease out, which was why it was crucial that we had the comparison community.
Absolutely. So what you just sort of touched on it right there too, the impact on public health, and what did you find?
Yeah. So what we found was that in Launceston, where they had the intervention, mortality rates did indeed fall, and they didn't fall in Hobart. And the result was strongest in men rather than women.
Wow.
And a bit stronger in the 60 to 75-year-old age group rather than the older elderly people, 75 plus. But it was a clear difference between the towns, and it was a clear reduction in men of about 10%.
That's fantastic. And what about future plans for the program now that you've seen success?
Yes, so it's a big challenge. Since that time, that was 2001, electricity has become more expensive. Our climate has been warming and changing. There's been an increased emphasis on wanting to use renewable fuels to be off grid. So there's actually a swing back towards wood heaters, and we're even seeing an impact on air quality that's going hand in hand with that. So I think our challenge is to get very smart about how we do it, and to subsidise highly efficient wood heaters. We have EPA certified wood heaters, but the fact is it's possible to produce a huge amount of pollution even from the best standard wood heater, and the only way we're going to be able to use biofuels in a domestic sense and not pollute is really to move to things like pellet stoves or ultra low emission heaters. So that's the vision that I believe we need to work towards. We've got a number of steps along the way to get there,
but it has become, partly as a consequence of doing a local Australian study, it has now become one of the top priorities in Australia to address this issue.
That's fantastic. I'm hopeful that that's something that we will learn from here in Canada, because here in British Columbia, wood stoves is a big issue as well, and we're suffering the same sort of issues that you are. That's all the time we have right now, so I want to take this time to thank Dr. Fay Johnston for joining me all the way from Australia, so thank you.
Thank you.